We're all doing a lot to try to keep our families safe and healthy during this COVID-19 pandemic. We're doing things like washing hands, wearing masks, practicing social distancing, and staying home when we're sick. But there are some other things we'd like to talk about today that can help keep your family safe and healthy at home. I'm Dr. Julianne Schwertfeger, pediatrician with Salina Pediatric Care.
Let's talk about kids in COVID-19.
So one of the things we're trying to remind everybody with COVID-19 is that obviously we're all taking lots of precautions for this, but it's still very important to bring your kid in for their regular checkups. The last thing we want is for a kid to get sick with something that we could be preventing, or for a kid to have a problem that gets worse because we're not seeing them to take care of it. So make sure you call your doctor to get those well checks done. And it's also really important to be getting your routine immunizations, especially your flu shot this year, and to be having your scheduled visits to monitor your child's growth and development over time. So we are being very diligent about keeping well children and children who may be sick separated in the clinic in different physical locations. We're even having a lot of our sick patient population being seen by some of our own nurse practitioners at Stat Care, just to keep our patient population healthy so that they can come in for their routine checks.
Another aspect of healthy children is behavioral and their mental health aspects of it. And with not having as many activities, not seeing their friends, a lot more at-home time, what do you have suggestions for that?
This has been rough on everybody in all sorts of different ways. And kids have lost a lot of their regular routines, and it certainly has been a lot more challenging for a lot of children this year with all the changes that are happening in the world. So I think one of the most important things that we can be doing at home and at school and in our well checks with kids is to pay attention to people's mental health right now. Lots of kids are struggling with feelings of depression and anxiety, and some of these are exhibiting in ways that may not be obvious to parents or teachers. So younger kids may be having sleeping problems, they may be having more temper tantrums and behavioral outbursts, really because they're picking up on anxiety from this entire situation with COVID-19. Older kids may be having symptoms like being more irritable or frustrated easily. They may also be having some sleep difficulties. They can also have less interest in things that were really exciting for them before. And we can even have like eating problems and eating too much or eating less than usual, or even struggling in school for some of these kids. Can all be symptoms of having trouble dealing with what's going on with COVID-19. It's also really important to remember to keep home a positive environment for kids. During this time of change and upheaval, it's really important to keep things as routine as possible, keep those regular bedtimes, and make sure that kids are getting plenty of sleep. Make sure we continue to manage our screen time at home and keep those times on screens minimal. And make sure we continue to keep kids on their usual healthy diets and regular exercise so that we can continue to keep them healthy.
And thank you for watching. For more information, please visit salinapediatriccare.com and like their page on Facebook.